A Queensland infectious diseases expert has warned health authorities to keep a close eye on a new Omicron supervariant as it rapidly spreads overseas. XBB 1.5 has fast become the dominant strain in the US, but much about the subvariant is still unknown.
It's called XBB 1.5, a so-called Omicron supervariant, first detected in November and already found in at least 70 countries. The new strain is causing more than 40% of cases in the United States, a rise of 20% on last week.
Some of the properties that we're seeing unfold in the US do make it likely to become a dominant subvariant.
It will probably eventually become the dominant strain in Australia.
It's unclear whether it's more contagious than other Omicron variants, but according to experts, it needs to be watched very closely.
It seems to bind more strongly to the ACE2 receptor, and that's the receptor the virus uses to get into our cells. And so that means it's likely to be able to outcompete other variants.
XBB 1.5 is also likely to render previous protections less effective.
This variant kind of evades the antibodies.
Our antibody response, both from past infection and from vaccination, just doesn't work quite as well.
There is some good news, though.
No different symptoms and certainly no increased severity, according to what we know so far.
We haven't seen the acute rise in hospitalisations and deaths.
The new subvariant isn't on Queensland Health's radar at this stage. It's a spin-off of the XBB strain, which makes up 1% of our COVID cases, while BA 2.75 remains the dominant strain.
I'd like to see more sequencing of clinical isolates so we do have a good picture of what's circulating, and then if the need arises, we can adjust our response.
It's unlikely we'll see a repeat of last year when the first Omicron wave peaked in late January.
Delaying school going back shouldn't be something that we consider moving forward.
Claire Todd-Hunter, 9 News.